Mood disorder. A mood disorder is a mental health condition characterized by significant and persistent disturbances in a person's emotional state. These disorders primarily affect a person's mood or emotional state, leading to disruptions in daily functioning. Types of mood disorders. Depressive disorders. Major depressive disorder, characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in daily activities. Persistent depressive disorder involves chronic, long-term symptoms of depression lasting for at least 2 years. Bipolar disorders. Bipolar I disorder involves episodes of mania, elevated mood, and often depressive episodes. Bipolar II disorder, characterized by hypomanic episodes, less severe than full mania, and depressive episodes. Causes of mood disorders. Biological factors. Genetics play a role. Mood disorders often run in families. Imbalances in neurotransmitters are implicated. Brain structure and function. Abnormalities in the structure or function of certain brain areas, such as the amygdala and prefrontal cortex, may contribute. Hormonal changes. Fluctuations in hormones, particularly during puberty, menstruation, pregnancy, and menopause, can influence mood. Environmental factors. Chronic stress, trauma, abuse, or significant life changes can contribute to the development of mood disorders. Medical conditions. Chronic illnesses, neurological disorders, and certain medications may increase the risk. Risk factors. Family history. Having a close relative with a mood disorder increases the risk. Trauma and stressful life events. Childhood trauma, loss of a loved one, or other significant life stressors can contribute. Chronic illness. Some medical conditions like chronic pain or cancer may increase vulnerability. Substance abuse. Drug and alcohol abuse can worsen or trigger mood disorders. Diagnosis. Clinical assessment. A mental health professional will conduct a thorough evaluation, including a review of symptoms, personal and family history, and any contributing factors. Diagnostic criteria. Diagnosis is based on specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM5, physical exam and laboratory tests. To rule out any underlying medical conditions contributing to mood symptoms. Psychological testing. Assessments may be conducted to measure the severity of symptoms and cognitive functioning. DSM5 criteria for mood disorders. Major depressive disorder. Depressed mood most of the day, nearly every day. Markedly diminished interest or pleasure in almost all activities. Significant weight loss or gain, changes in appetite. Insomnia or hypersomnia. Psychomotor agitation or retardation. Fatigue or loss of energy. Feelings of worthlessness or excessive guilt. Diminished ability to think or concentrate. Recurrent thoughts of death, suicidal ideation, or suicide attempts. Bipolar I disorder. At least one manic episode, which may be preceded or followed by hypomanic or major depressive episode. Bipolar II disorder. At least one hypomanic episode and at least one major depressive episode. Treatment. Psychotherapy. Cognitive behavioral therapy helps individuals identify and change negative thought patterns and behaviors. Interpersonal therapy focuses on improving relationships and communication skills. Dialectical behavior therapy combines cognitive behavioral techniques with mindfulness to manage emotion. Medication. Antidepressants, commonly prescribed for depressive disorders. Examples include SRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors. Mood stabilizers used for bipolar disorders. Examples include lithium and certain anticonvulsant medications. Antipsychotics may be prescribed in conjunction with other medications for severe mood episodes. Electroconvulsive therapy. Considered for severe cases of depression or when other treatments haven't been effective. Hospitalization. For individuals at risk of self-harm or suicide, or those experiencing severe symptoms that require intensive care. Lifestyle changes. Exercise, regular physical activity, has been shown to have positive effects on mood. Sleep hygiene, establishing a regular sleep pattern, is crucial for mood regulation. Healthy diet, nutrient-rich foods can contribute to overall well-being. Support groups. Participating in support groups can provide individuals with a sense of community and understanding.